The eyes are one of the most important sense. As age advances, preserving your vision must be of utmost importance. A glaucoma is a group of eye conditions that damage the optic nerve, the health of which is vital for good vision. Combined with the aging population, we can see an epidemic of blindness looming if we don't raise awareness about the importance of regular eye examinations to preserve vision. At Medicircle, we are conducting an awareness series on glaucoma with eminent ophthalmologists for the World Glaucoma Day to boost awareness and educate people about eye health. Hi, this is Smita Kumar, your host, and today in this initiative, we are going to speak to Dr. Pranay Kapdia. Dr. Pranay is the chairman and medical director of Kapadia Eye Care, which is a chain of eye clinics offering laser eye surgeries. Dr. Kapadia is also a designated partner of Laser Vision International Center, which is the top of the line LASIK center located at Bandra, Mumbai. He is one of the leading laser eye surgeons in Mumbai, practicing since 2 decades, and is experienced with more than 50,000 no injection laser eye surgeries for cataract and LASIK. Hi, Dr. Pranay. Welcome to the World Glaucoma Awareness Day series at Medicircle.
Thank you very much, Doctor, for this kind introduction. And this is a very important day that we are talking about the world glaucoma, where the disease is so rampant and at the same time it is so underdiagnosed. Okay. So thank you so much for inviting me over here.
The pleasure is all ours, Dr. Pranay. So to begin with, who is at risk of developing glaucoma, and does aging increase the chances of glaucoma?
This is a very, very important question, because when we say glaucoma, we call it as a silent thief of sight. So why do we call that? Because first and foremost, the age of 40 and above naturally predisposes you to glaucoma. So imagine the population, half of the world population is treating for glaucoma. And the more than half of those population, they are not being diagnosed with glaucoma. As the age increases even further, by the age of 50, by the age of 60, the chance of glaucoma increases even further. So who's at risk for developing glaucoma? First and foremost is the age. Second, very important thing is the family history. So if you have one family member, then the chance of getting glaucoma is a very high chance. And if you have more than one, then it's a very, very high chance. Thirdly, there are certain drugs like steroids, immunosuppressants. So if the patient is under treatment for any of those conditions in which the patient needs these kind of drugs, the patient becomes a high-risk patient. Another important thing is eye injury. So many times, even the sports people, they get injury. They may have received an injury maybe 4 years back and 5 years back. There may be some trivial injury in the past, and still, after a few years, the glaucoma can develop. There are certain diseases in the eye, like people with high myopia, the high thick glasses, people with thin corneas, people with vascular diseases, and there are a lot of diseases in the eye which can predispose the patient for glaucoma. Even certain systemic diseases like blood pressure, diabetes, that can cause increase in the incidence of glaucoma. So overall, glaucoma is a group of disorder in which all these risk factors will just predispose the patient to developing it much more as compared to the normal.
Okay. So the next question is like, how much is it preventable? Like, can it be prevented by anything, like, and it does not occur only even if one of the parents or even both the parents are getting, affected with glaucoma? So is this preventable?
This is even more important to know that glaucoma is one of the diseases in which the most important thing that we should do in glaucoma is to prevent the sight loss. So preventable disease means you try to detect the disease at such an early stage that it does not progress, so that the patient will not ever get blind. Because glaucoma is a disorder in which when the patient comes to us, basically if I detect glaucoma, I need to counsel the patient that you are on road to blindness. If not treated, you've met me somewhere on the road and I want to take you back. But unfortunately, I cannot take you back because that road is already gone. So all that I can do is I can stop you going further on that road, and we will be staying at that particular place. So what does it mean? At whatever stage the glaucoma is detected, that is the stage at which the glaucoma has to be kept stationary. You should not allow the glaucoma to progress. So in a way, what is important in glaucoma is to prevent vision loss. And for that, the patient has to undergo certain specialized tests. Unless and until these specialized tests are done, the early part of glaucoma is not detected. So we wouldn't call it as a completely preventable disease, but it should be a disease in which the disease should be detected at a very, very early stage. So there are certain type of salient features of the disease because of which we can do certain tests to detect this particular glaucoma.
So yeah, that is what we'll like to discuss, Dr. Pranay, like how can one identify such a problem at an early stage so that it is preventable and less damage is made?
So first and foremost, there has to be a regular eye examination. Our country, we are not used to going to the doctor for what is called as a preventive health checkup. So we have so many cars in our house which go for regular checkups, but we do not go for our regular checkups for our body. And that is the reason many of these diseases, which are silent diseases, which can be picked up only on these routine examinations, do not get picked up. So glaucoma is one of that disease. So the regular eye examination, including the eye pressure checking by a qualified eye surgeon, that is a very important thing for anybody to do. Suppose any of the risk factors that I have mentioned, if any of those patients have any of those risk factors, then that patient has to go after the age of 40 every year for a checkup. Then there's certain specialized tests. The specialized tests are first and foremost the vision which is affected is the field of vision. The peripheral field of vision is affected. So imagine if I'm looking straight and if I'm looking at the periphery. If the periphery of the vision starts getting reduced and more, even in the most intelligent patients, this particular thing gets detected if it is more than 25% loss, and whatever is gone, that is permanently gone. So that is why the field of vision test is one of the first tests that we perform. Of course, we also perform the test in which we are going to check intraocular pressure. Then there are certain scans which can be done, like the nerve scan, the optic nerve scan called as a OCT, corneal thickness test like pachymetry, angle of the eye measurement that is called as gonioscopy. So these 5 tests, which are very, very important. So unless and until one goes to the qualified eye surgeon, these tests are not routinely checked. So patients may say that, okay, we've gone to the opticians and we've checked our glasses and everything is fine. That's not the kind of checkup that we're looking at.
So
that's
to emphasize on this preventative health checkups, which is so necessary that if it is done, you can actually find out such kind of diseases which may actually lead to vision loss. So just a random question here, that how frequent the eye checkup or the eye health checkup should be, like in a year, or how many times should we visit for eye health checkup?
It's a very important and valid question. I would recommend a general body checkup along with the eye checkup every year. If it is not possible, it should at least be done once in 2 years. Now, there are certain patients who have thick glasses, or the patients who have diabetes, the patients who have one glaucoma person in the family. They have to get the checkup once in 6 months itself.
Okay. That is really, really important information to be shared here. Dr. Pranay, one last question on glaucoma is that, is it reversible? Like suppose if a patient has been diagnosed with this, can we reverse the condition? As you said that there's only one path and it's difficult to go back. So what is your take on this?
Yes. If I have to give a yes or no answer, then it would be a no, that it cannot be reversed. But if I give you a little more explanation into that, consider that the optic nerve is the one which gets damaged over here. So there is a constant pressure on the optic nerve. Whenever one gives pressure to any of the organ, the few of the cells will start dying. But few cells will be almost at the half-dead cell stage. So if you increase the circulation at that particular stage, then those half-dead cells can become completely functional cells. So some amount of improvement is definitely seen in all the glaucoma patients initially, when we detect the glaucoma, patient is documented with some amount of damage. When we start treatment and then we recheck it, at that time, at least 2 to 3%, or maybe sometimes even in the region of 5 to 10% of vision recovery is possible. So some amount of vision recovery is possible.
So mostly in all these cases, a surgery is required. I mean, the medication cannot treat it.
No, actually, glaucoma is a disease which has changed its paradigm right since the time that I was studying in KEM hospital around 25, 30 years back, and as compared to now. At that time, most of the time, the disease of glaucoma was equated with the surgery. Now we have such wonderful drugs available in which the patient has to put just one medicine, one drop at bedtime, and the disease is prevented from going further. So it's that simple, just put certain drops like maybe once in a day or twice in a day, but it's important to take these medicines. It's like asking me that, okay, if I have a blood pressure, if I have a diabetes, if I give you only 15 days course, will my diabetes go away? So this is not a disease which is curable. This is a disease which is controllable. So you take, when one gets this particular disease, you take these medicines and you take these medicines lifelong, and you will probably never require a surgery as long as you're doing your regular checkups. That's important.
Yeah, that's really a very big respite, because a lot of patients actually fear surgeries. And due to that fear, they never go to the doctors. So in this case, like if it is preventable and if it is in early stage, even a medication for the lifelong or for the, lot of months or years, I think it can control the condition, just like other lifestyle disorders like blood pressure and hypertension and diabetes.
Right. So it's very important that most of the time when we do this preventable eye checkups or preventable body checkups, most of the small surgeries can be ruled out because you are detecting
Yes.
your at such an early stage that most of the surgeons would in fact prescribe you medicines and say that you take this and you're going to be fine.
That is really great. So thank you so much, Dr. Pranay Kapdia, for your valuable time and inputs at our show, for awareing our audience for this World Glaucoma Day. And I think our audience are very much, they are knowing about the treatments and also when to exactly approach a doctor and also take care of their eye. Going to an ophthalmologist on an yearly basis would really help them and save them for from so many diseases. Thank you once again, Dr. Pranay, for joining us at Medicircle.
Thank you. Be safe, be healthy, and please take care of yourself and your eyes. Thank you very much.
Thank you.